I think that's a huge advantage. So you're saying that you're frequently forgetting what you used to do previously, like the past day or the day before that. I would also again suggest to note down every day what you're doing, so that if you forget the next day, you can go back again and remember it. So that is one step which I think would be helpful.
We are forgetting names. No, many people we know, but the time they want to tell about that person, I can imagine that person's face and everything, but the name is not coming.
They will come and tell good morning, how are you, everything, then we will know who it is.
But we can't find names, we know only.
We can't do that. All the names.
No, probably because of the popularity that you're coming across so many people.
But at the same time, when I remember seeing that person, I'm not able to respond, no?
I know I am Kala.
So what we will do, interact with friends. It won't be 10 minutes back.
I'm terrible at names. I remember faces, I remember names. I don't know which face has which name. It happens with me. I agree with you. It's just
So
terrible.
she will be around. In case you want to discuss with her, she will be, once we finish the camp, she will be around to speak. Thank you so much. I now request Dr. Gopi to address us.
Right.
Over to you, sir.
Sure. Welcome to Purna Holistic Care, which is integrated with the primary service of neurology. And from my side and Dr. Shashikant are integrating this multiple allied system of medicines in the form of Ayurveda, yoga, acupuncture, moxibustion, and even psychotherapy and all those things. So primarily the major part of our service is yoga and Ayurveda, where Ayurveda, many of maybe trying to explore many of the Ayurveda component, how it will help you. But majorly there are 4 things you need to understand in Ayurveda, how it helps. Ayurveda is not just a medicinal treatment like any of the other system of medicines. Majorly it works in lifestyle, second one is diet, and third one is some medicinal treatment. Fourth one is the medicinal treatment come some therapies also, and last one is most important, mind-body medicine, that also explained in Ayurveda very well. We call it as Sattva Vajaya, that is winning our own mind over the uncontrolled thoughts. So in this part, starting from lifestyle, definitely you may be trying hard to how to make a good lifestyle. Starting from diet, each and every activity in the whole day, how we do, that matters a lot. Each and every moment you are trying to enjoy, that itself is a very good lifestyle. How to make it a joyful life, that is what is lifestyle correction is required. But many of us, we don't have any clue how to make it joyful with so much pain. So in that part, with the support of the medications and the therapies and other lifestyle correction, so slowly we will getting some confidence, some the positivity in the mind that you need to carry through. That makes a very good lifestyle itself. In fact, if you really try to explore what exactly the beautiful lifestyle is, it's nothing but healthy mind, the positive mind and confident mind. That itself will make us very much good into the lifestyle. Lifestyle correction happens from the mind only, what I mean is. So the next is the diet. Diet again, it will be part of lifestyle only, but still we strongly believe in 3 major categories of the diet part, the food part particularly. Sattva, Rajas and Tamas are the 3 major. You may be knowing how exactly it works. Sattva is the more of modern way of explaining is more of a bland diet kind of thing, not any extremes of spices, oily, or even too much sweets. All those things better we need to avoid. That makes a very good program in connecting the body and mind. This is where the healing starts. We call it as self-healing. And Of course, according to your personal challenges, the spasticity or rigidity or fatigue, all those things, there will be certain modified this one, that is professionally it is our responsibility. And simultaneously the next part is the medicinal treatment. Again, it is a professional responsibility. We will decide what type of medications works for you. The medication wise, there are multiple formulations, the tablets and decoctions and asavas, aristas, the fermented medications, and most appealing the part of the medication, in particularly in Ayurveda for neurodegenerative disorders, is a ghee preparation. It is a wonderful preparation. It helps in multiple ways. Modern science also, it easily agrees this particular preparation, how it works, because in brain, the BBB, that blood-brain barrier, that is a very challenging part to enter into, medicines entering into brain part. The ghee is the best the media which carries the medicines more fluently. That part, very strangely, in ancient text, all the textbooks, it is clearly mentioned none of the other medications works for any of the mind related disorders. So mind is a function of the brain only, but most of the brain disorders, they are very well healed. With our practice, we understood that it will be very well healed with the ghee preparations. There is no inhibition for taking extra ghee for weight or any other things. They are all very superficial understandings. It won't give any untoward things with the ghee preparation. Make it very clear. If it is properly classically prepared ghee preparation, it's a very good formulation. It helps in multiple ways. Practically, we have seen. Only the lacking part with Ayurveda is two major things globally. One is documentation and the research thing. Another thing is the standardization of medicines. That is also very much lacking. Once it comes to the documentation and this one, again it is very hard to do researches, because Ayurveda believes its own philosophy. It is a different philosophy we have, where this Vata, Pitta, Kapha and all those things, it is very much difficult to integrate with this modern science. So in that part, so we don't believe in treating the patients. We believe in treating the person only, not diseases, the person. There is a huge difference between treating the person and the disease. In this part, it is very difficult to convince the modern aspect. There we are really lacking with this in competing with this modern science. That is why even modern doctors also, they are not ready to accept so easily this part. That is a different story. But very few doctors like Dr. Rajesh here, they are very much into the this one, our ancient philosophy or treatment, both Ayurveda and Yoga. And in that part, we are fortunate to integrate that particular stream in this our treatment part. And the third part, as I mentioned, that is also important, the therapies. There are multiple therapies, a set of therapies, we call it as Panchakarma. Panchakarma is 5 types of cleansing the body with the different techniques. In that part, what we do is we are cleansing the body with different techniques: vomiting therapy, loose motion therapy, the enema therapy, bloodletting therapy, and one Nasyam therapy, we call it as head and neck cleansing technique. So with that, what happens is we are detoxing the body. Again, scientifically it is quite difficult to explain what exactly the detox is, where is toxins, what is toxin, and very difficult. It is more of experiencing. Once you go through that, you will experience how effective it will be. And the part of that, again, according to the conditions, according to the challenges what you have, we will design what type of therapy will suit you. Accordingly we do. Generally speaking, this particularly MS part, it is more of Vata and Pitta combination that works on. In that part, 2 major therapies really works wonder: the purgation therapy and the enema therapy. So we call it as Basti Karma. And again, both the things are very much in depth. We have lot of details of that one. In particularly the Basti, it works wonder for many of the people. Again, it is individually based, personally designed programs there. And last part is I am slowly entering into the gross level to subtle level in the form of body to mind part. Body to mind, again, the Ayurveda strongly believes in the integrating body and mind, called as the Ayurveda doctors, particularly we are Vaidyas, we call it as. What we are is, we are the health promoters. We start to promote your healing and slowly it enters into self-healing. We are, what I mean is, we have that power of healing inside. Slowly with the effort of these natural promotions, slowly you will be entering into natural healing. That is possible, that we need to explore only by putting our efforts, individual effort, in the form of, we call it as subjective and objective, both the things it is. The subjective part, of course, the professionals will help. The objective part, it is your own responsibility. Try to understand the function of the mind, how it works, how it, the positive mind and the power of inner power of mind, finding it out. With that, we are slowly entering into that healthy, the healing. That is most natural way of healing, we call it as. We can explore. People have shown, multiple people have shown, extreme diseases, even cancers also, it is proved that without any medications, with the power of mind only, they could heal their, many of the diseases. So with this understanding, we have this collaboration of this Ayurveda and yoga, you must be knowing very well. But still, in this part, in this juncture of our journey with multiple sclerosis, yoga you need to understand very well. Again, it is the major part of the yoga, we call it as yoga therapy. It is individualized, personal based program that makes a very good program, that is really required actually, where according to your challenges, as I told, symptom wise and the disease wise, we will customize one particular set of practices and we will deliver it. That only really helps. Otherwise, if you do in a group or if you do your own by watching any of the videos or YouTube or anything, that won't be helpful. Also, this therapy part, we call it as a training program. In the training, we do two things. One is instruction, another one is corrections. These two things are the most important thing. While doing yoga, many times we assume that we are doing correctly, but without our knowledge, we will make a lot of mistakes. That correction happens with a very good teacher only. It's most important thing. With that, one is the gross understanding that physical practices. Slowly again, it will enter into the more subtle practice. It is called pranayamas, the breathing techniques. And last is some of the mind related practices, either relaxation or meditation kind of thing, that really makes you into a wonderful journey of yoga, where you see happiness. The whole goal of the yoga is nothing but the calming down the mind, settling down all the thoughts. With that, we are exploring the power of the mind. With this understanding, if we start the yoga, that really makes a wonderful program. Otherwise, we will end up with doing it mechanically. Few days we do, then we will give it up, and that makes again another very ordinary program of this kind of therapies. So with this understanding, welcome to Purna, and I am helping you. I believe in more of interaction than the giving the lectures kind of thing. If you have any doubts or anything, we will discuss openly. Let us see how we can progress with our journey with treating the MS. Any of you have any doubts regarding yoga and Ayurveda both?
After examination of the patient, according to you have to customize the therapy.
Right.
According to the patient's needs.
Correct. Correct. You can sit, sir, comfortably. Make yourself comfortable. I can hear you.
Audible to people.
Yeah.
So how do we, which is a starting point?
See, that's what initially we will assess you.
That is,
Ah.
we start our treatment at this point, and then you are involved in the care and therapy.
See, for the first part is the assessment. See, in both in Ayurveda and Yoga, we have our own style of assessing. Unlike just speaking about your present history, past history, family history, and all those things, there are a few other things. In particularly mind, we are really very much focusing on, where we will collect two things. One is your stress level, another one is your the constitution. That also we strongly believe in treating. With that, we will come up with the design of the treatment, either the therapies or medications, and again followed by the yoga. Yoga suits to everybody, so there is no barrier for yoga. And these two things, definitely the medications and this one, it is purely our responsibility, and you need not really worry about all those things. That is how it goes.
The only mention about Ayurvedic medications,
Correct.
not about the other
Yeah.
practice. That you use some metals, I mean, basmas,
Correct.
gold, silver, mercury, like that.
Right.
According to the allopathic medicine, these are all nephrotoxic in the sense.
You are
They
right.
Toxic to the kidney.
Correct.
They produce renal failure. And all the stories about that. As you said, there isn't any real standardization in the preparation of the medication.
Correct. So that
how
part.
do we lay that definition?
Correct. That part, definitely you have a very valid question, and it is really need to understand very thoroughly, in depthly. It is a very sensitive part of the whole discussion also. Basmas or any other heavy metals, if they are prepared in a classical way, 100% sure it is a very safe medicine. It won't interact, it won't be any toxic kind of thing, anything. And we will consider other way, like there is no documentation, there is no the research, okay, but we will come up with other thoughts. So many years we are using, hundreds of years we are using. How many patients are died with any of the metal taking or the other basmas or whatever? So before the British era, it is just exclusively it is going on with the only this Ayurveda part. So much glorified it was. There is no other way of treating also. Even before paracetamol and all those things, we are all living happily and healthily throughout our life. The modern the medication, the major contribution of all these routine diseases is thanks to that multiple medicines in the form of high BP or cholesterol or everything. They are able to extend our lifespan thanks to modern medicine in that part, generally speaking. And other part is also, I am not against or denying any of the modern science. It's a wonderful system of medicine. It is a gift for us also. And coming to our own the concern on this particular part, this one, if it is, as I told, if it is prepared classically, there is no problem at all. Very comfortably we can take it. It won't intervene with whatever the medicines you are taking also. Even steroids or even the biological treatment also, it goes very well with it. It is proven, and we have tried. Many people, many doctors tried also. It is no problem at all. Only thing is, at least for myself, while writing each and every medicine, I will be mentioning the company name in the bracket actually. So those are all time tested, and they are very standardly prepared medications. Definitely you can rely on that part. No inhibitions at all in that part. Yes. And MS and all, see, these type of diseases are coined lately. The disease was there even before it was there. It was discovered, it is not invented, the disease. So in that part, we can correlate in our own ancient text, whatever the symptoms mentioned in that text, we can correlate very well with the MS, but in a different variety of contexts actually. So in one particular disease classification, we can't fix it to this MS, but many of the different texts it is saying manifestation of MS in different form that we can correlate to very well to that particular different context, and simultaneously we are seeing the effect also. That is the best part. In that part you may be wondering how you are treating MS with the Ayurveda. It is not at all mentioned in ancient text. It is a latest coined disease. It's as good as any other diseases also. Like that. Okay. It's a very broad question. It's a cure part. As you know, this different categories of MS, RRMS, SPMS, and all those things. We can drag the recurrence actually with the symptom dragging. It is definitely possible. The cure, if it is dragged for many years, I can call it as cure, like that. But so far in my experience, I didn't cure anybody. I can't claim. Yes.
They are not having any relapses or any.
Relapse differing is biggest advantage. No? Correct.
That's exactly what even allopathy is doing now, right? Managing the condition.
You are right.
From an outcome standpoint, there's not much of a difference specifically for MS.
You are right.
Both allopathy and Ayurvedic we can take
Together, yes.
You can take it. That is why we go through all the details, whatever the medications and details you are taking, then only we will plan. It is not just writing some pills, take it along with that. It's not. We can't do like that.
Time gap of some half an hour or 1 hour.
Correct. That gap should be there. Half an hour gap we need to give it. Yes.
Another fundamental question, you said if it's done classically, then it's okay. But how does one, a layperson like us know how it has been?
That's what I'm telling. At least for myself, I'm writing in the bracket the company name. So others, I can't assure that this one. But of course, many of the doctors, even leading doctors also, they, without trusting anybody, they prepare themselves.
Yeah.
That is also there. Again, without the knowing the content of all those things, it is quite difficult to comment on that one, that part. So it's quite.
That's been the major problem because I think not just for MS, but if you look at Ayurveda, like you said, that's standardization. So if you go to someone who has been practicing for generations, their family, they make it for us, it may work or not.
Yeah.
Two things. One, if that person is not there tomorrow, then we don't know what is it they put together. Second is if there is a side effect, we don't know the constituents to go ahead and see how to kind of fight against those side effects. Unlike allopathy.
Yeah.
So while allopathy has side effects, the fact that the standardization is there is why all of us are.
You are right. So in that part, in the ground level, there is lot of works need to be done for the Ayurveda. So fortunately, Ayush ministry is helping us lot in nowadays, at least. In this government, and I don't know where we will end up with. The going on, lot of researchers and all those things are going on, but it is, as I told, scientifically proving it, bringing it under the lens of science, it is really difficult. So one thing assurance is, as I told, classically prepared, no problem at all. And again, it is a custom made this one. For one particular Brahmivati, it is given for the MS. It's a very absurd thing. We don't believe in all those things actually. So individually, there are two parts we are considering for each and every person, the patient wise. One is the Prakriti, another one is Vikriti, we call it as. Prakriti is the natural form of our constitution. Vikriti is what exactly the disease manifestation is. These two combination we understand, with that we will come up with the formulations. That is how it works. Yes.
Do the medicines help reduce the symptoms? Not about treatment, like we said, it doesn't have a cure, but will it help alleviate the symptoms that you are...
That is what I am telling. The fatigue part, spasticity part, rigidity part, there are wonderful combinations of therapies and medications. It works actually. We have seen a lot of patients improving with that one. There is a very good boost, no? The confidence and that itself. As I told, the symptom relieving is a first level of treating, and slowly we will enter into the immune system level, like stabilizing immunity. If it is in a inflammatory state, again we will do a different variety of therapies and treatment. If it is in a recession state also, there is a different thing we do. All these things are all. Any remnants of that previous episode of the manifestation of disease, we do in different way. Quite complex to explain because individually the designed therapies and treatments, but confidently I can tell that it is very effective. The symptom management also in the longer time, the immune system stability, the prevention of recurrence, all those things are it is seen. Okay.
It's good to hear that those systems come, I mean, holistically you're approaching the problem.
Correct.
That's the, rather than, I mean, I am a allopathic man, so I actually don't know anything about Ayurveda.
Correct.
And without knowing that, it's difficult to say that it is not useful, it is no good, or something like that.
Yes.
It's fine that it's good that we are shaking hands.
In fact, it is a long time dream of our team, Dr. Rajesh here, and fortunately, Dr. Rajesh here is very much inclined towards our ancient system of healing. It is with the multiple hurdles, we finally come up with this shape. Actually, it is just a beginning. We hope for a bigger, scenario. I don't know where we end up with.
So that the documentation part is taken care of. That what the present science, what is the evidence-based medicine? Where is the evidence?
Correct.
So when you shake hands, I think there will be documentation. And documentation brings in, knowledge.
That is what we are really keen on, documenting and making a very good research thing that will end up with acceptance.
To be, I mean, modify our beliefs.
Correct.
Or your beliefs.
Correct. That's what I am telling. The acceptance, the general acceptance will be more with that. Now there is lot of inhibitions with both the ways. Even many of the Ayurvedic doctors, themselves are not at all confident treating all these things.
Right.
And many of them unfortunately still go much lower. They will adulterate the medicine, so they will just boost up with some of the tranquilizers kind of thing. All those things hamper the purity of Ayurveda, unfortunately. So with this, all this idea only, we come up with this particular integration. Okay.
And both of them are taken together. Does the detoxing effect of Ayurveda in any way diminish the allopathic medicine? Because most of the MS medicine is immunosuppressant. So that is one way.
I didn't get your point exactly.
So take both the medicines together, Ayurvedic and allopathic.
Correct.
So there are things like the Ayurvedic medicine detoxifies. Does that in any way affect the effects of the allopathic medicine?
No. That won't be thrown out.
Right.
Detox means it won't take out any medicines in the body. Detox is, the general understanding of detox is, after metabolism, whatever the wastage, like the gross wastage will happen in the form of urine, stool and sweating and all those things. There are subtle level of wastages that will make a lot of nuisance. Particularly, we strongly believe this fatigue symptom, it is the more of the toxins in the muscles are accumulated. Once it is wiped out, that will make a very good program. In that part, the proper medication and all those things, it is naturally we can't take out from the body. Any of these natural therapies won't. There is some extreme therapies called chelation therapy and all. They will take out those chemicals and all. Yes.
You all give a lot of emphasis on food. I believe food is the best medicine. I've
You are
seen
right.
that in the last 2-3 years. Any inputs that you have for us specifically on
See,
MS?
that's what. So the MS part, grossly speaking, some moderation in the food really makes a very good program. Extremes you avoid. As all of you know, the proper big list of junk food definitely you need to avoid. Along with that, refined food, all refined food avoid. Throw away refined food. I will tell you. Refined oil, the sugar, the even refined salt also, the table salt, all these things are equally poison to any of the person. It is not only for it.
Substitute salt.
Salt, the regular crystal salt you can use, no? Crystal salt. Rock salt not required. It is a medicinal form actually. Rock salt is not required. Typically this Himalayan salt and that pink salt and gold, these are all the better. In fact, I prefer, if you are in connection with any of the coastal people, they classically know that one. Even Kerala people also, they will be knowing how naturally they will prepare the salt. That it is a little bit muddy only, musky color, but it is very safe. It has all a lot of alkaloids which counter with which are harmful of that particular the salt also. The refined salt, it is refined grossly in the form of filtration and all those things, but it is hardly anything counteracting alkaloids are left out in that one. That is really harmful. It is same is in any of the other food also. Even the refined maida or white suji, all those things are really not at all good. They are all proven that they are pro-inflammatory things. The refined food are pro-inflammatory. Correct. Okay. Anything else? So the yoga, I am really keen on yoga. Yoga you all should practice. So we do, but the only thing is again we need to make it custom made. So definitely we can plan one a taste of yoga. We can make it in the online. We both, Dr. Shashikant and me. Shashikant, can you come? You can start something. Give it some additional information on yoga also. Right. That is how. Correct. So disease, we are not treating the disease. We are treating the person. That is how it goes. Okay. Yes, Shashikant, come. Yes, come.
No, sir, not yet. So there is a good initial discussion of how Ayurveda and modern medicine are integrating, and or at one particular platform we are integrating. I want to clarify a few things which are very straightforward questions. One, your question was how to find out that is there any heavy metals or anything in that particular medicine. So for that there are three answers. I don't want to take the name of that particular institution. So there are three institutions. One is a particular lab, one is some name followed by drug house, Bangalore, Malleshwaram. You give the sample medicine, whatever you are taking from whichever doctor, note down the doctor's name, prescription and medicines, give it to them. Around 4,800 rupees, they'll tell you all the details. What is the arsenic content, lead content, all the medicinal content, you give it to them, they'll give you. So this is available for us for you to know that any doctor from any source, you get the medicine, you go and give it to them, they'll give you unbiased opinion. It is a government funded institution. You can note down also, I don't mind, I am not sure if it is there or not. Bangalore Drug House is what I usually, we go under, it's like undercurrent, under carpet, we don't reveal to anybody, but we get to know that which particular company have how much percentage of metals on all, we know it at the back, but we don't want to create a hustle or we don't want to create problem for that particular institution and for us legally, so we'll keep quiet, and we use in our prescribed medication, we make sure that in this particular place where I call, if you remember, if you imagine like one circle is a conventional medicine, another circle is complementary medicine. So when these intersect, that part of we call it as integrative medicine. We try to keep it as evidence based as possible and as much take out the bias around that particular things. And there is false allegations also from both the sides, which we need to segregate without debating or without falsely accusing each other, but we have to accept the fact that in India there is no proper promotion of Ayurveda and Yoga, which should be more. In Western aspect, if you check National Council of Complementary and Alternative Medicine, NCCAM, they give maximum funding for yoga and Ayurveda worldwide, not India. Ayush and ICMR is second highest. So not India, we try to see anything indigenous, we try to double check. Anything Western, if a McDonald's comes to India, McDonald's old burger will cost you around 39% of unwanted fat. We never check that. And when same things comes to India, it will become 59%, if at all we see. But we order and we get it. Where there we will not check about what is the percentage of bad fat we are having. We never check. So that's our minds.
You should teach everyone that Tai Chi.
Yes, sir.
Chinese thing, no?
So yeah.
So we'll all become Kung Fu Pandas.
Yes, sir. Yes, sir. So what I mean to say is we need to encourage that. I want to take one example what sir mentioned, Kung Fu Panda. So when I've seen Chinese counterpart, government institutions give permission for allopathy hospitals when there is a proper TCM unit in that particular hospital, then approval of that mainstream medical hospital, they'll approve it. So what they mean is government initiative to promote Ayurveda in India, it is lacking compared to other Western things. That's why when you compare WHO, acupuncture, all other systems will come first because they are all more, they are pushed towards more research activities and by byproduct of that, more of allopathy doctors accept it. So we go in that category only. Here we exclusively use Ayurveda, Yoga, acupuncture, evidence-based as possible. So let's talk more practice. We'll do a Jacobson's progressive muscular relaxation technique, which you already know it and multiple times you have done it. So now post-COVID era, we'll redo it again.
Is anybody practicing that regularly?
No, sir. That is a strong point where I started coming a little less to that because we used to give only 3 remedies. One breathing technique because we want your lung volume to increase so that we don't know why the disease comes, and if your lung volume is better, there might be some somewhat like neuroprotective activities should be more, neurotoxic activities should be less. If your oxygen saturation is better, it can fight a little better. So to cope up with that, we have some, increased stress reduces your immunity, as a lot of research activities say. Especially I mentioned one particular doctor which all the doctors has to note down, and I want you to read. Dr. Robert Sapolsky is first doctor you can note down. His research work on the stress and individual systems, stress and digestive system, stress and heart and stress and immunity and all. Dr. Robert Sapolsky is called as father of modern stress. Second one is Dr. Robert Sapolsky. Yeah. Second one is Dr. Herbert. Robert, I am not sure. It's American. I think it's from Stanford. His wife is a neurophysician. They both work with baboons, and a lot of research they have published. Second one is Dr. Herbert Benson, who was the first person to do a integrative medical research and given the word called as the relaxation response, which we never study in our medical system. The relaxation response, Dr. Herbert Benson. Third, another person is Dr. Mehmet Oz, who is a cardiothoracic surgeon who practices yoga and Ayurveda, pre and post cardiothoracic surgery. Fourth one is who is the present Adiraja Maharaja. His name is changed, Adiraja Maharaja. His name I am not able to remember.
I think you have to give us a note.
Yeah, I'll be sending all note on MS group, so not much people respond. Dr. Tony Nadir. These 4 people's work you see, there will be mind-blowing work, and not being Indian. So JPMR is Jacobson was a Canadian physician who was very much interested in Yoga Nidra. He adopted Yoga Nidra and modified in the form of a biorhythm, taking out all the other Omkara. He's taken out all the godly issues, all those which we Indians don't like. Has taken out and made it as a progressive relaxation technique. It is also called as NMR, neuromuscular relaxation technique. Let us practice that. It's very simple technique. 5 seconds contraction of certain group of muscles followed by 5 seconds relaxation of same group of muscles, and be aware of that. Yeah, and I think before that, I think sir can speak some few words. Sir.
So good evening, welcome to our center for this mic yeah? Okay, all right. I'm fine here, Ashok. Kansta idea? Okay, so what happens, we should understand the natural history of MS, okay? So if you look at large data, left untreated, half the patients will have disabilities, mainly with walking and cognition in under 15 years of MS from the time of onset. And untreated, almost 90% of patients will have disabilities in 30 or 20-25 years. Okay, so there are some risk factors for developing disabilities that we need to understand. So previously it was all like, you make a diagnosis, wait for 6 months, sometimes wait for a year. And there were people who used to say that, when we were students, they used to teach us that, okay, you just made a diagnosis of MS, why don't you wait for 2 years? Amele treatment ಮಾಡಬಹುದು ಅಂತ. But what happens is the MS is different in each patient. It's not, and within a given patient also, it's not same. There will be ups and downs, fluctuations. How the immune system reacts at different points of your time is very different. So it's important to recognize the risk factors of developing disabilities and address that early so that disabilities don't happen. Now, the disability is mainly because of shrinkage of the nervous system. Normally, after a certain age, I'll put it as 54. I am just 52 now. So, beyond 54 years of age, the brain starts shrinking by about 0.5 percentage, 0.4 percentage to be precise, every year. And this shrinkage is little bit more in people with MS. And that leads to more disabilities. And if there are lesions in the lower part of the brain or spinal cord, we have several instances where brain is absolutely normal. But when you go down brainstem, medulla, spinal cord, if these regions are involved, there are disabilities. So if we recognize these risk factors and treat it early, we can prevent many of the problems with MS. Now, unfortunately, the medicines that we have as of now, they don't get into the brain. So the disease is primarily in the system, in the bone marrow. That's where the immune system is. So disease primarily happens there, and then the cells get into the nervous system or the blood-brain barrier anta undi there. So where it crosses, the cells cross the blood-brain barrier and get into the brain. Ali hogi rest madbittu allinda it creates injuries, like having a Trojan horse, something like that. So our medicines, they all work inside the periphery, they don't get into the brain. So whatever has gone in, nothing can be done for that. If you give rituximab, a small percentage goes there, very, very small percentage. So now of late we have given intrathecal rituximab. I think Raju Nair was our first patient, and his speech has improved. Yes, he has improved a lot. We gave a second dose, we finished yesterday. So this is one way of bypassing the system and reach the brain directly. That brings down the cost also. Just 25-30 milligram is what we need to inject. So this is one that we are trying. But if you look at big data, they say it doesn't make a big difference. But at least in his case, where we can't give, he gets a lot of infections, we can't give systemic rituximab. So presently we don't have too many options. The newer drugs which are going to come, like tolbutinib, it's called BTK inhibitors. These kind of medicines get into the nervous system. Hopefully in a year, it's under clinical trials. Hopefully in 1 or 2 years, it should make a big difference in treating MS. Now the thing is, what happens to patients where the brain is already shrunk? So is there anything in your system which can make the brain grow? Yeah, which can make the brain grow, right? So not that brain always shrinks. If you look at the accountant's brain, accountants are people who write a lot of things. They are always in focus with money. So they keep on calculating. Their brain is not only sharp, and the RAM is faster. So they are sharp, and their brain doesn't atrophy that fast because they're always calculating and counting. So if we do some new learning, that's what keeps the brain active. And plus, if you use some supplements which can boost brain functions, that can make a big difference in preventing brain shrinkage. If we prevent brain shrinkage, then probably yes, we can prevent progression of the disease. All right. So probably our effort, Shashi, should be to do some research on alternative. In my field, like, we don't have too many options to prevent brain shrinkage. Of course, neuropsychology can help. The neuropsychology who gives the training, who makes people learn, think, that can help to a great extent. But if we have something which can get into the brain. Recently, we happened to go to a place near Kanyakumari. There's a very big Ayurvedic doctor, but he is well read in allopathy, and half of his practice is in neurology, and he gets patients from different countries. He has been very kind to come, and he'll come sometime to help us. So what he said is, Ayurveda has different types. You got something called gridam. Gridam means which is ghee form, and that is the one which hits nervous system because it's fat soluble. A brain is fat. So if you have a brain disease, you should eat medicines in the Gridam form. So they already have the concept of getting something inside the brain, and if it is in the blood, you use something which is aristam, or which is alcohol based, good for us. And water form. What is it called? Kashayams. So these are three forms of Ayurvedic therapy. But unfortunately, we don't have too much of proof in the alternative systems. What we have from the allopathy side is all evidence based. These medicines, you have data. You say that, okay, you give this medicine. So for example, you take interferons or dimethyl fumarate, the success will be around 30 to 50% each. You treat 100 people, 30 to 50 will achieve no evidence of disease activity. You use a drug like alemtuzumab, your success rate is close to 90%. Rituximab or ocrelizumab, Tysabri, all these things will fall around that 75 to 85% categories. So none of these medicines are 100%. So still, there is some progression happening, and some degeneration still takes place. But there is a good category of, this is what has misled many people. So there are some patients with MS who have a very benign disease. It roughly happens in about 20 to 25% of patients, what we call as a benign MS. Even if you don't take treatment, nothing happens. And this floats,
They will tell the others that
I'm okay. Yeah, correct. Correct.
And all those things, and everybody will say, yeah, I'm taking medicine, I'm getting side effects and all those things. So
yeah. So
and we know of a lot of our people who are
and then we have a lot of people who have come back from the learned US. They say, and many of them are on with problems. They say that we read about the medicine, there are side effects, so they've not taken medicines. But you should know that there are effects. Even when you walk on the road, there can be side effects. We need to be a little bit cautious about what we are thinking and doing. So as of now, we'll focus on improving the brain volume. Maybe this year should be our theme, to improve brain volume. Yeah.
Just want to add.
ನಮ್ದು ಸ್ವಂತ ಚಿಕ್ಕದು ಇದೆ, ಸೆರಿಬೆಲ್ಲಮ್ ಮಾತ್ರ ಕೆಲಸ ಮಾಡ್ತಾ ಇದೆ.
Just want to add this particular volume that precisely how the examples you are giving about the people and all those things. Exactly what happens is that this matter is the consciousness. The more you are conscious about your thoughts in the mind, that itself is a very good program. You can keep the brain health more precisely. That's what yoga believes. That's what I am very keen on projecting yoga here in this particular. It is not just yoga doesn't mean just doing some asanas and the breathing techniques and all those things. It is much more deeper. So if you really make a harmony between mind and body in the form of bridge of the breathing, that makes a very good program. Unless you taste it, then you don't understand the power of yoga. So only the more than theory, it is the practice. That is how it comes.
ಅದು TV ಸೀರಿಯಲ್ ನೋಡಿದ್ರೆ ಬ್ರೈನ್ ಸ್ಪೈನಲ್ ಕಾರ್ಡ್ ಲೆವೆಲಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ತದೆ. He could recognize, that's what happened. Did you go for a bone marrow transplant or something like that? Said, no, I'm just doing diet, nothing else. Fruits, vegetables, fruit juices. Because she had tried everything, almost all drugs and progressive MS. So she reversed quite well. And that's what happened to Terry Walls also. But these are all anecdotal cases. You can't generalize, So then, you should not stop medicine and go for diet. So it's not like that. But when you add multiple dimensions to the therapy, it makes a big difference.
So yesterday we had day for yesterday we had Alzheimer's and dementia.
World Alzheimer's Day.
World Alzheimer's Day, 21st.
Yeah.
And so there were some questions, like people were saying that if you move your tongue like this, it's supposed to, improve the memory and other things.
Walk backwards.
Yeah, so all that. So the people who are having some experience, they were saying that there's no harm in doing it. So you can do it.
Correct.
So,
Not in public. Not in public.
so like what you are saying, these diets and all those things, they're not going to do any harm anyway. So,
Correct. They're anecdotal cases. You can't generalize. You can't say that it's a medicine, you take that, it works.
But they can always try it along with one another.
Yeah, true. So we lack evidence in many of these things, but just lack of evidence doesn't mean that it is not there.
Right.
So we in clinical practice we have class 1, class 2, class 3 and class 4 evidence. Class 1 is something which is based on RCTs. So for a drug to get approved, it has to go through a RCT. So rituximab is a typical medicine which will never get an approval because it cannot go through an RTC. Companies don't make profit. Whereas ocrelizumab, which is exactly like rituximab, got accelerated approval in few months. Was exactly similar. And they are going to market it in India now. So I told those company guys, we will not write ocrelizumab. We already have a better drug at 1/10 of your cost. Yeah, fine. So let us have something to eat, Rani ji. Busy idea. Yeah. So before that, you met Dr. Aishwarya, right? So she is going to become a doctor. She's a Gujju. So she is studying MPhil, right? Masters in Neuropsychology at Christ University.
She said Telugu.
Telugu? No.
I can speak Telugu.
Yeah, but she will speak in Gujarati. Ki soche, like that. Huh? So chocho. Okay, whatever. So she can help us with improving the brain volume. So I given her some task to do SDMT. So there's a form she has taken print out. If anyone wants to try how your cognition is working, she can. What you are going to do in this?
So as you can see, from 1 to 9 there are numbers, and below each number there are distinctive symbols there. So 1 has different symbols, 2 has different symbol, 3 has different symbol. Below that you can see 4 rows too. Each row has 1 to 9 numbers. So you have to see, as 1 has the dash symbol, so where 1 is mentioned in the row, you have to put the dash symbol. And for the 3 you have to put the square symbol. All the rows you have to fill with the symbols mentioned above to the corresponding numbers. I can show you a demonstration if you'd like to have it.
But yeah, after the break, huh? So let's try. Whoever wants to try. Let's see how our brain works. I will not try. Come, please join. Yeah, come.
And on behalf of all of us, we'd like to thank you for all these years. I was just this morning, honestly, I was just thinking that without your support, I don't know how we would have survived. So let's give a big round of applause.
Shashi has made one more discovery. He got us one guy from Redcliffe. So Redcliffe is a lab which runs in US, UK, and now they are into India. So that guy has offered us good rates for our investigations. So maybe we can use it if required to do those investigations. Come. Yeah, please. Yeah. Whoever can go, please go. Yeah, please help yourself.